Hey everyone, my name is Manoj Matthew and I'm a body MRI fellow at Stanford University. I'd like to present to you what's new in GU imaging this month, and I'd like to thank the senior editors for all the help that they provided. This retrospective study was used to evaluate the usefulness of T2 values in the classification, grading, and predicting the evidence of lymphovascular space invasion in patients with cervical cancer. The group evaluated 63 patients with T2-weighted imaging, DWI, and accelerated T2 mapping sequences. The T2 mapping sequences provided both quantitative T2 maps as well as synthetic T2-weighted images. The T2 values between well and moderately differentiated tumors compared to poorly differentiated tumors were significantly different. Additionally, tumors with lymphovascular space invasion also had lower T2 values. ADC values also varied significantly between well and moderately differentiated tumors compared to poorly differentiated tumors. The group suggests that the ability of accelerated T2 mapping to produce T2 maps and synthetic T2-weighted images and the ability to predict lymphovascular space invasion makes it a useful tool for the evaluation and staging of cervical cancer. This group conducted this prospective study on 54 patients with newly diagnosed cervical cancer to evaluate the associations between PET-MR, imaging biomarkers, and tumor stage, progression-free survival, and overall survival. A PET-MR was obtained on a 3T MR scanner with diffusion-weighted imaging with B50 and B1000 images. Two radiologists measured the ADC min as well as the mean and max SUV, metabolic tumor volume, and total lesion glycolysis. Advanced tumors and tumors with nodal disease had lower ADC min and high metabolic tumor value. Max SUV was a predictor of progression-free survival, while ADC min predicted overall survival. The group concluded that PET-MR imaging biomarkers are associated with tumor stage and survival. This is a review article that provides an overview of the use of machine learning and deep learning approaches in the characterization of renal masses. The review covers fundamental concepts, current applications, and challenges to the implementation of machine learning in the characterization of renal masses. The article describes that the availability of many open source, free, and easy-to-use toolboxes have created a low barrier of entry of machine learning into radiology, with current uses in renal mass characterization to include determination of malignant from benign lesions, tumor aggressiveness, tumor subtyping, and radiogenomics. The authors suggest that larger data sets and new algorithms will lead to limitless possibilities to help move the field forward. This is a study performed evaluating 152 patients with 274 proven prostate cancer lesions from 5 different institutions. 9 different readers evaluated the multiparametric MR studies using PIRADS version 2 with and without an AI-based detection system. When the readers used the AI-based system, they were only able to accept or reject lesions that were within the AI-generated attention boxes. The overall sensitivity for the detection of lesions was higher for the AI-based system, with an AUC of 77.5% for AI and 74.9% for multiparametric MRI alone. There was moderate inter-reader agreement between the AI-based system and multiparametric MRI alone, with greater sensitivity for lesions in the transition zone for the AI-based system. Overall, the group suggested that the AI-based system showed significant improvement in the detection of transition zone lesions. This is a retrospective review of 419 patients with asymptomatic microscopic hematuria. Patients with benign etiology of hematuria or prior urologic malignancy were excluded from the study. Of the 419 patients, 200 were selected to determine appropriateness, which is defined as a UA with greater than 3 RBCs per high-power field. Approximately 29% of the randomly sampled 200 patients did not meet a UA criteria for radiologic evaluation. 1 solid renal mass and 1 possible bladder mass without any evidence of upper tract urothelial neoplasm were identified. This group conducted a retrospective study of 91 patients that aimed to evaluate the inter-observer agreement and diagnostic performance of vesicle imaging reporting and data system, VIRADS, in predicting the presence of muscle-invasive bladder cancer. VIRADS is a 5-point scoring system with the aim of establishing the likelihood of muscle-invasive bladder cancer with a score of 4 out of 5, suggesting muscle invasion is likely. The presence of muscle invasion ultimately requires patients to undergo radical cystectomy. In this study, the muscle invasion status of the tumor was determined using histologic slices, and this was compared to VIRAD scores that were assigned by 7 radiologists of varying experience. There was moderate to substantial agreement amongst experienced readers and between experienced and inexperienced readers. The sensitivity and specificity of obtaining a score of 4 or greater is 74.1% and 94.1% for experienced readers, and 63.9% and 86.4% for inexperienced readers. This group did a retrospective analysis in 104 consecutive men who underwent MR-guided biopsy of transition zone atypical nodules that were upgraded using DWI. There were 95 PIRADS category 3 lesions, 40 of which were upgraded based on DWI. There was slight to substantial agreement between radiologists when categorizing each of the lesions. Of the 40 upgraded nodules, only 27.5% had prostate cancer, and 7.5% had clinically significant prostate cancer, compared to 43.6% and 20.0% nodules that were diagnosed as PIRADS category 3 using T2-weighted imaging. The group suggests that the prevalence of prostate cancer in DWI upgraded transition zone atypical nodules compared favorably to conventional T2-weighted imaging, which validates the use of the DWI upgrade rules introduced in PIRADS version 2.1. The authors performed a systematic review evaluating the performance of gallium PSMA PET-CT. The group used 7 articles comprising 389 patients, with pooled sensitivity, specificity, positive likelihood ratio, and negative likelihood ratio of 0.97, 0.66, 2.86, and 0.05, respectively. They showed that gallium PSMA PET-CT had excellent sensitivity and high negative likelihood ratio in the initial diagnosis of prostate cancer. Thank you for tuning in this month for the Academy of Online Radiology Education, GU blog.